And the answer is C is incorrectly labeled. So the bone of the brachium, the single bone of the brachium, is the humerus. The femur is the single bone of the thigh. Joints are defined as the unions between two or more bones or cartilages. Joints are classified according to the type of connective tissue uniting the bones. Fibrous connective tissue unites bones meeting at fibrous joints and also fills the spaces between them. Fibrous joints unite the bones of the skull, attach the teeth to the jaws, form substantial membranes between the radius and the ulna in the upper limb, and the fibula and the tibia in the lower limb. Cartilage unites bones meeting at cartilaginous joints and again fills the spaces between them. Cartilaginous joints unite the hip bones anteriorly at the pubic symphysis and form part of the intervertebral discs uniting vertebrae. Cartilaginous growth plates, called epiphyses, form temporary cartilaginous joints in developing long bones. So here's a stack of vertebrae, and between the thicker parts, the bodies of the vertebrae, are the intervertebral discs. And again, these are examples of cartilaginous joints. Motion at fibrous joints and cartilaginous joints is limited to compression, stretching, bending, and twisting of the connective tissue, either the fibrous connective tissue or the cartilage in the cartilaginous joints. And so it's only deformation of this connective tissue in one direction or another that enables them to move. By contrast, synovial joints allow for greater mobility. The standard features of all synovial joints include a joint cavity, which in itself allows for greater mobility. The bones can slide against one another rather than having a plate of tissue to form. Hyaline articular cartilage capping the bone ends. A synovial membrane, which secretes a slippery synovial fluid. The synovial membrane lines an outer fibrous capsule consisting of dense connective tissue. So it's a two-layered capsule. It has fibrous connective tissue on the outside and then a slippery synovial lining on the inside. The coefficient of friction in a synovial joint of the hyaline cartilage ends with one another is approximately the coefficient of friction of ice on ice. So it's an excellent system for minimizing friction and wear and tear. And then finally, either outside the joint as external ligaments or on the inside of the joint as internal ligaments will be pieces of connective tissue that will limit the motions at the joints. So the features of all synovial joints include the joint cavity, the hyaline articular cartilage on the ends of the bones, synovial membrane lining the capsule producing synovial fluid, an outer fibrous capsule of dense connective tissue, and internal or external ligaments reinforcing the joint and preventing unwanted motions. Synovial joints are classified according to the shapes of the bones meeting at the joint. This is an example of a plane joint. This is an example of a hinge joint. This is an example of a ball and socket joint. This is an example of a condyloid joint. This is an example of a saddle joint. This is an example of a pivot joint. And we'll look at all of those joints again in more detail as we look at the different musculoskeletal cases. Bone congruence at joints is the degree to which bone surfaces are in contact, the degree to which they fit. Most limb joints are synovial joints, and the motions permitted at a synovial joint are determined by the shape of the bone articular ends again, the ligaments and other structures, the capsule, limiting motion at the joint. So bone geometry and restraining capsule and ligaments. Here's an example of a plane joint. So in this joint there are two relatively flat surfaces. Gliding occurs when the articular surfaces of the bones meeting at the joint slide across one another with little or no angulation. So this is an example of gliding in a plane joint. Here is a series of synovial joints. So when we think of the joints of the spine, we usually think of intervertebral discs because they're the most troublesome. But there are a series of synovial joints between the arches of the vertebrae behind the articular discs, and those are the flat surfaces of plane synovial joints with a synovial membrane with a little capsule. And as you flex and extend your spine, not only do the intervertebral discs change their shapes, but the bones meeting at the synovial joints will slide across one another. So 2 sets of joints in the spine, the cartilaginous joints, the intervertebral discs uniting the bodies, and then a series of synovial joints between the articular facets on the back of the vertebrae. So here's a quiz question, and we're asking you to tell us which of the following joints is incorrectly labeled.